Greetings to all the viewers. I am Dr. Alisha, Research Coordinator at Sancheti Institute of Orthopaedics, Rehabilitation and College of Physiotherapy, Pune. Today we are going to have a session on choosing a research topic. Choosing a research topic is a very important part of physiotherapy also, be it academicians or clinicians. Both require research as a front domain to progress ahead as professionals. In this session, we will be covering a few things like the process of identifying a topic, example-based strategy. I'll be using an example to help you all understand how a research topic is chosen. I'll be also giving you a very brief overview about the database that is available for research and how ChatGPT and other AI tools can be useful in helping us coming to a research question, and a very short overview about framework for a research question. So these are the topics that I'll be covering in this session. Now let's start with who needs to or who can do research in physiotherapy. Starting with the academic side of it, final years or interns, basically they do a very basic level of research to understand the process. Then we come to postgraduates who do a little advanced level of research, and of course PhD scholars. So these fall under the category of people who need to do research to understand the process and for their academic benefit. Apart from students, apart from people who are studying, we also have academicians and clinical physiotherapists who can definitely go ahead with research. Yes, clinical physiotherapists also. You need not need a very high-fi degree as a physiotherapist to be into clinical research. That is why if you see the last box here, I have written physiotherapists working in any domain can do research, conduct research, or help conduct research. So coming to the process as to how this process starts, first we definitely need to identify the interest, the topic in which we have interest. Without interest in a particular topic, it may become impossible for any researcher or any student or any clinician to conduct a research. Now the interest usually starts where you have a question about a certain scenario that you're studying or observing on a day-to-day basis as an academician or as a clinician or as a physiotherapist altogether. After identifying the interest, we need to narrow down the topic. And after you have narrowed down the topic, we need to identify the gap or explore the results. And once that is done, we go and test the topic. Now, these things may seem very vague right now, but I'll be explaining each and every step of the process of coming to a topic in detail. But this is just a very brief overview of how exactly we can come to a topic. So you see this box where I've written this interest and research study. The red arrow indicates that it's a very long process from identifying your interest to coming to a research study, because it takes a lot of reading, it takes a lot of research that we do. Research in the sense you look up of data, you look up literature, you look evidence, or you look text that will help you understand your topic. So beginning with the first step, that is identifying the interest, it always starts with an idea. Now this idea can be generated in a classroom, at clinics, through textbooks, or while having discussion with the peers, or even different experiences as a physiotherapist. So even in classrooms, for example, the first time I heard knee osteoarthritis in my classroom during my second year or third year maybe, it I just it I just had this one thought that knee osteoarthritis may be something which my mother always complains about, that she has this knee pain. Maybe it can be knee osteoarthritis. So this is where the biggest of research, and it can start in a very small classroom also. So classrooms are the first place where we can expect a research question to pop up. Clinics, of course, we see patients on day-to-day basis, and there may be certain observations. There may be certain practices that we do, which may be helping the patients, but it may not have been documented either in our textbooks or either online when you search blogs, articles, or any source of literature for that matter. Sometimes such questions can also pop up while you're going through your textbooks, learning about different pathologies, learning about different topics, and of course, discussion with peers. Suppose you're having a case study discussion where you can come up with a very different, unique idea that may not have occurred otherwise. Experiences is again more or less related to your observation as a clinician and as a therapist. So I'll be taking an example of knee osteoarthritis here because that'll be easy for all the viewers to understand. So talking about knee arthritis, this is my first step. That is, I identified my interest. I'm interested in this particular topic for a lot of reasons. So the question mark that you see here is why knee osteoarthritis for a lot of reasons. Starting from my home, I told you all that my mom has knee pain. So when she says knee pain, when I was an undergrad student, for me, knee pain is just knee pain. I didn't realize that she may be having knee osteoarthritis unless I learned about it. So the topic of interest here is knee osteoarthritis. Now, how to come to a research question from just these two terms is what I'm going to take you through. So when I heard knee osteoarthritis for the first time, I would look up or read about this. So for me, the sources that was available as a student were books and whatever textbooks or whatever reference books I had in the college library, and I read about knee osteoarthritis. As a professional, once I had a base knowledge of what knee osteoarthritis exactly is, what is the pathology behind it, what are the management strategies, what are the pharmacological and non-pharmacological management strategies that can be used to treat knee osteoarthritis, I went on to journals. So this you see are journals or articles that are available online that will help me understand what has been done to improve the conditions of patients who are having this disease. And recently, we all have been using AI tools that can help us give information. Of course, we can use we can use AI as a reference source of information and do real digging online elsewhere also. But of course, AI is a very AI tools are a very good adjunct to the information that we want to read about. But once we have identified the topic, before we go into the actual literature part, we need to ask these 5 questions or 5 Ws before identifying an actual research problem there. The first question is why? Why did we choose this particular topic? What interests me about knee osteoarthritis so much? And what are the opinions that are given by researchers all over the world about it. So we need these questions very clear before we come to an actual research question. So see, it's just starting from a very small phrase like knee arthritis to a very long title that I'll come up in the next few slides. So from that 2 words condition to a whole research question, the journey is a very long one. And if you want to make it easy, I think these 5 questions are very helpful. The next question is who. Who here refers to who are the information providers on this topic? When we come to research studies, we may involve patients, we may involve healthcare professionals in general, we may involve physiotherapists. So we have to identify if I want to do some research on knee osteoarthritis, whom I am I going to include in my particular study, plus other things like who will be publishing this information, and do I know any organizations that can help me with this particular research. So for example, if I want to identify some issue with respect to knee osteoarthritis in patients, do I know any hospital, or do I am I associated with any organization that will help me get knee osteoarthritis patients very easily? So this is the second question that we put about. Next, we come to what. What is the main question? Because knee osteoarthritis is a very big domain again. And in that, what are the major questions that you want to ask? So, for example, the main problems associated with knee osteoarthritis are usually pain, and the patient has difficulty in walking, climbing stairs, etc. So, which are the major questions that you would want to answer through your research in this particular pathological domain? Is there a debate about the topic? For example, should we go for non-conservative management if say knee osteoarthritis is at a severe stage? So should we go for surgery or not? Should we treat it with physiotherapy or not? So these are just few examples that I'm giving, but is there a debatable issue around that? The second last thing is where. Where are you planning to conduct this research? Is it at a local level? Is it at a national level? Or is it at an international level? and which are the specific places or say clusters of a region that may be affected by this particular entity that we want to research about. In case of knee osteoarthritis, the geographical the geographical aspect, maybe in the sense if we are researching in a hilly area, will the uneven terrain be one of the factors that may influence our research? Or in urban areas where people have a lot of running about, but then they use vehicles and all. So these are just giving you very random examples so that you all understand that why geographical consideration is important here. Last one is when in the sense, is it something very trending? For example, use of AI in exercise prescription and all. So if we talk about 5 years ago, we didn't knew what AI was and how we could use it in the healthcare domain. So if we talk about the current trends of the topic AI, that is what the when questions is relating to here about. And so these are the five questions that we need to ask ourselves as a researcher before we go ahead with what we want to do in a specific pathological interest or not. So the actual research starts when you know what you want to search about, but then that's a very big horizon to explore. So we need to read up literature. Now, what does literature mean in research? In research, literature means what is the work that is already done in the past. And why is it important for us to look up literature or look up work that is done in the past? It is first, it will help us identify the gaps in the sense means what is not really explored in a particular condition in the form of treatment, in the form of assessment, in the form of anything that will help us improve patient care. uh, or else we can also build up more research on existing results. For example, if there's a research that says that a particular medicine A is useful in reducing pain for patients who have very mild knee osteoarthritis, so I may use that medicine for patients who have moderate knee osteoarthritis. Just an example. Generally, there's a lot of a process that goes upon identifying these topics. But this is in general that we need to understand how literature search can help us improvise our topics of research. And of course, it helps us narrow down the topic that we're looking upon, which brings us to the step two of the process of identifying a research question. So the step one was identifying the area of interest. For me, it is knee osteoarthritis. Next, we will come down to how do we narrow down this topic. So where do I search about knee osteoarthritis? Of course, I'll go from the reverse order. Textbooks, they'll give me a basis of the topic. They'll give me a very basic idea of what the entity is, of how it is going to affect the patient's quality of life, how it is going to affect the community as a whole. That you can understand from the basic reading that we do in the textbooks. AI tools like ChatGPT, Semantic Scholar, Ortho AI, these can be used to give you a vague idea about the current trends in that topic or what are the research topics that we can actually use in the area of interest that I have. And of course, the biggest place where we search literature are the databases like Google Scholar, which is very good for beginners. Then we come to PubMed, Cochrane, Medline, and Embase. So these are the databases which we can use for literature search. I'll be using Google Scholar for this session as it is the basic one. And maybe when I take a session on literature search, we can explore more about the other databases mentioned here. So coming down to step two, that is narrowing down the topic. So when I first thought of knee OA, I had no idea about what I'm going to do with knee OA as a research topic. So let me just put it a little particular that I want to do assessment of pain in knee OA. Again, this is a very broad term. And if I just put assessment of pain in knee osteoarthritis, that is Google Scholar, by the way, if the screenshot of Google Scholar. So if I just put assessment of pain in knee osteoarthritis, you see there are about 5,82,000 results. I'm not going to open each and every one and see what is there. So how about refining the statement here? That is assessment of pain in knee osteoarthritis using ultrasound. So that again is one step lower to narrow down my topic of interest. It brings me down to just 61,000 results. You see the difference between 5 lakh and what the number I have in the second step. But again, 61 is very important. So again, I'll be more specific in this topic, and I just put like assessment of pain and knee osteoarthritis using ultrasound in obese individuals in Indians. So now you see what specificity I've added here. First, I want to assess pain in patients who have knee osteoarthritis using ultrasound, and now in obese individuals, and that too in Indian population. So I've come down to a geographical. So if we see the W's, let's see if this is answered or not. So we come down to almost 8,620 results. Again, 8,000 is a very big number to screen. So again, I'll be more specific about the topic, or I'll narrow it down. Uh, what helped me narrow it down to come to this topic that you see in between is, so while I was searching the third topic that I put down here, I came across a reading that demographic profile and spectrum of ultrasonic sonographic findings in medial knee pain. So now this study talks about specifically medial knee pain in patients who have OA. So then I just thought maybe I may not put medial knee pain, but instead of just knee pain, why not make OA specific? That is assessment of knee pain in unicompartmental OA, because we know now this is again narrowing down way too very specific here. So with that, I just got 480 results, and I think which is a fair number to screen if you want to go for a good research topic. Again, you can do many changes in here to bring it down to 10, 20, and that we can there's a whole lecture that we can take on literature review for the same. So when I put this topic, I got a study, the abstract of which I have just put a screenshot over here. So this study was done to evaluate pain-related soft tissue structures of the knee with ultrasonography. So I started with just OA knee or knee osteoarthritis, and then I thought, let me assess pain in OA knee. And then how I wanted to assess was using ultrasonography. So if you see, this was a study which is actually relating to most of the interest that I had. It's just that here it mentions pain-related soft tissue structures. So this gave me, or this struck an idea in my mind that this also is a possibility that knee osteoarthritis, which is by in its nature a bone disease, there the pain can actually come from soft tissue. So this is something which you are knowing about, or the literature search actually gives you a more better vision of how to go about with research. So in this particular study, they used conventional radiography and ultrasonography to check if there is any soft tissue related pain that is happening in patients with ONE. So here, the first box that you see, conventional versus ultrasound, is what this study was about. So while I was just thinking about how ultrasound can be useful in assessment of knee pain in ONE patients, this study compares it with conventional ones. So it gives me a better idea that this is a good thing to do, that if we compare with what is already established and a new therapy. Then, like I told you all, we usually think that osteoarthritis, I mean, as beginners, of course, not as professionals, that osteoarthritis is a disease of the bone. But what if soft tissues are responsible for causing knee pain in patients with osteoarthritis? So these were the two things that I could actually identify from this one. And if you see in conclusion that Baker's cyst, or the results, if you see the results part of it here, Baker's cyst was significantly more frequent in symptomatic knees. Now, this is something which was new for me when I read it for the first time. Okay, Baker's cyst is actually causing pain in symptomatic knees, and even in asymptomatic knees, although it is just 2.5%. So when I talk about exploration of the results, it means that here, if you see, they've compared it with asymptomatic knees. How about me doing a study in asymptomatic knees only in patients who are diagnosed with osteoarthritis, but they do not really have symptoms? So if I do a study that will identify that will identify if there are any soft tissue lesions that have the potential to cause knee pain in patients who are asymptomatic. So this is what I mean by exploration of results. Now, how about identifying the gap? Identifying the gap over here can be, now this study focuses only on Baker's cyst. What about if there are other soft tissues or soft tissue lesions that may be responsible for causing knee pain in ONE patients? So this is identifying the gap. So these are the two things that you can consider, and out of which one you can take and go ahead with. Now, from all of this, I just came to this one question, that how many studies are done to identify soft tissue lesions leading to knee pain in ONE patients? So this is identifying the gap, which brings us to step 3, or we can explore the results like discussed earlier. So this is the step 3 that I'm talking about. That this is the question that I had after reading this particular abstract that I shared with you all. How many studies are done to identify soft tissue lesions leading to knee pain in ONE patients? How? The present study that I showed you all had just identified Baker's cyst. But what if there is many other soft tissue lesions that may be responsible for knee pain in ONE patients? So that is identifying the gap, and it can bring me to a provisional research question. That is, uh, so provisional research question is just the first research questions that you form, which you can see here, that do soft tissue lesions lead to knee pain in ONE patients, to be very basic about it. So that can be my provisional research questions, or the very first research questions. Discussion here, I mean, you may discuss it with your teachers, you may discuss it with your peers to get a better idea. Okay, see this, I've just read about this particular topic, and what do you think? So after that discussion, you can go for a literature review, and then you can test the research question. So this brings us to the last point of our step, that of our process, that is testing the research question. But to test the research question, you need a provisional research question and a literature review to support this. Now, coming to AI tools that can be useful. So this is a little thing up in between, that apart from the databases that I mentioned earlier, these are the this particular screenshot that you see is from ChatGPT. I just randomly put a prompt to ChatGPT asking, tell me research ideas for assessment of factors contributing to knee pain in individuals with OA and are obese. So if you remember, if we go back to the slide here, that we had just started with assessment of pain in knee osteoarthritis, and then we narrowed it down to pretty much quite a few things, coming to the topic that if there are any soft tissue lesions. So apart from this, I also want to see if there are any other factors that may contribute to knee pain in patients who are diagnosed with knee OA and who are obese. So ChatGPT gave me quite a few good suggestions here, that we can go ahead with biomechanical analysis. We can assess muscle strength and function. If there is any issue or any dysfunction or any pathology that is involved with joint structure and alignment, and some inflammatory markers. So these are just the suggestions that the GPT gave me. It's up to me as a researcher if I want to pick up from any of this, but this actually gives you a better, broader perspective of how we can use, how we can understand which are the factors contributing to knee pain. But for me, the soft tissue lesion was somewhat interesting. So I would prefer going ahead with that and not using this. It's completely up to you as a researcher what you want to explore in your area of interest. Coming to the research question, that is the final step of us coming to a conclusion about what we want to do. So there's a framework that we follow to identify or to put up a research question, FINER, where F stands for feasible, I stands for interesting, N stands for novel, E stands for ethical, and R stands for relevant. So when I say feasible, it means how feasible is your topic when it comes to number of subjects, when it comes to requirement of technical expertise, when it comes to resources and time, and what is the scope of the research that you're trying to do. So when I talk about number of subjects, in my case, will I get ONE patients easily? Or if I am affiliated with a hospital, how many ONE patients are coming there? Are they enough for me to go ahead and conduct this research? When I talk about technical expertise, the study that I was looking forward to was with respect to using an ultrasound machine for diagnosis of soft tissue lesions. Do I have the machine? Do I have the resources that can help me conduct the study better? And also how much time is going to be consumed in this whole process is what I need to look at. For students, they may have a few months if they're interns, they may have a year at least if they're postgrads, and a little more if PhD scholars. So this is the time that you need to consider while coming up with a research question. Manageable in scope, as in how much, what is the scope of the results? I mean, there's always a hypothesis that we make. So if there is a research question, we also write a hypothesis for the same, and we see if how much far it can benefit the community, the researcher, and the field as a whole. Second, of course, it should be interesting because it's the first thing we take go ahead with to pick up a research topic. Novel, it should be something new. It should not be something which is already done and which already can be predicted. It should be something new. It should um, generate interest in the readers who are not really associated with the research that you're doing. It should be ethical and it should be relevant. Relevance, when I say it is more of clinical relevance, of course, community and societal relevance is also important. But as clinicians, as healthcare professionals, clinical relevance is what we really need to look upon when we come to a research question. So, summing up all together, let's first start with the step one, that is, we need to find an interesting topic. Once we get the topic, we look up, we read up. After we read up, we narrow down the topic. Again, after we have narrowed it down, we have to look up and read up again. And once that is done, we need to identify the gaps, or like I said, we can explore the results as well. And then we research. That's how the term comes from. That we constantly keep searching, we constantly keep reading up of whatever is done in the same thing, and then again go back to the step two, that how we can narrow it down and come to a final research question using the final framework. So this is all for from my side, and thank you for watching. I thank all the viewers. I thank Parag Sancheti sir. I thank Manisha Sangvi ma'am and Apurva Shimpi sir and the entire Physio TV team for giving me this opportunity. Thank you so much.